Thank you for joining us for the fourth episode of the Salivary Gland Research Podcast. Today I'm joined by Dr. Melinda Larsen from the University at Albany and Janet Church, who serves as the current president and CEO of the Sjogren's Foundation. We are excited to hear about the foundation and to learn about life with Sjogren's. And without further delay, I will hand it over to Dr. Larsen, who can begin by giving us a brief introduction.
Hi, thank you, Joey. So I am Melinda Larsen. Some of you may know me better as Mindy Larsen. I am a professor at the University of Albany, and I recently became chair of the department here. So I've been in the salivary gland field for quite some time. I started in the salivary gland field as a postdoctoral fellow with Ken Yamada, and I was really introduced to the field by Dr. Matt Hoffman. He was doing research at the time on the branching morphogenesis and the early development of the salivary gland. And I really fell in love with the gland and the questions that I had about how it develops at that time. So when I started my lab at University of Albany, my work was mostly focused on the development of the salivary gland. But I've recently, in the last few years, switched to research that's more relevant to clinical questions. So we are now working on salivary gland fibrosis and mechanisms of tissue regeneration that may be used potentially clinically in future therapeutic approaches. We're also doing a little bit of work on salivary gland irradiation in terms of looking at the effects of fibrosis on lack of gland function, loss of function after radiation, as well as a little bit of work with Sjogren's patients through a collaboration I have with Dr. Neil Goldman-Leitman at Albany Medical College. So I will turn it over now to Janet Church to introduce herself.
Thank you so much, Dr. Larsen. I'm honored and grateful that you invited me here today. So I am Janet Church, and I'm president and CEO of the Sjogren's Foundation. But almost more importantly, I am a Sjogren's patient. So I perform this role with a great deal of personal experience and understanding of the patient's lived experience. I am actually not a career nonprofit CEO. I actually come from the technology industry, running businesses in the tech sector. But I came to Sjogren's by being diagnosed with the disease about 20 years ago, got involved with the foundation, was asked to take a board seat, which I did, then was asked to be chair of the board. And then when the previous CEO and president went to the Arthritis Foundation, the board asked me to step in and be CEO and president, and I am honored to do so.
That's really exciting to have someone both coming from the tech field with experience in that field and also being a patient in charge of the foundation. So I think you have a unique perspective really to share with us today. So I know from talking with you, there's a lot has really changed with the way we think about Sjogren, the way we talk about Sjogren's. So I wonder if you could kind of start the conversation with updating us as to how we should be talking about Sjogren's and thinking about the disease.
Absolutely. First and foremost, we have recently had a name change, and this has been an international name change. We are dropping the term syndrome. Please, everybody, now the disease is called Sjogren's disease. And this is really to reflect what we've really learned about the disease, especially over the past 5 years, but it also reflects the true patient experience. We don't have a collection of minor symptoms that are displaying. We have a serious and systemic disease that impacts our quality of life. And that term, Sjogren's disease, is incredibly meaningful to patients. Now, historically, we've thought of the disease as a dry eye, dry mouth disease. And patients really have been marginalized when they've been presenting other experiences with the disease. And through the years, we now know that Sjogren's disease is truly systemic. Yes, it does impact our eyes and our mouths, and dryness is a significant issue. But we also have neurological symptoms, including the nerves not firing to produce tears and saliva. We also have other neurological symptoms, dysautonomia. POTS Sjogren's is one of the leading causes of POTS. And certainly peripheral neuropathies. We also have organ involvement, and we have a higher risk of lymphomas. So the disease actually is becoming more and more really researched, and we're becoming more and more informed about the disease, which is excellent. We suspect that only about 50% of our patients in the US have been accurately diagnosed. So this means about 2 million patients are out there suffering, not getting treated for Sjogren's disease.
Yeah, that's troubling. There definitely is a need for better diagnostics in this field. Since you had talked a little bit about the patient experience, I wondered if you could tell us, a little bit more. I know it's most common in women, and when does it usually manifest, and how long is it really until most patients get diagnosed, the ones that do?
Yeah, the whole journey of diagnosis is really complicated. It can sometimes be almost like more of an art to be diagnosed by Sjogren's experts than actual clear diagnosis with blood tests or lip biopsy. Lip biopsies are complicated to read, and it does take kind of an experienced expert to read them should someone's blood work be negative. We actually have about 30 to 40% of our patients that call themselves seronegative, so to speak. So they are often ANA positive, but SSA Rho negative. So they may be diagnosed with a lip biopsy or, again, the art of a Sjogren's expert. Historically, because it was just dry eyes and dry mouth, and that symptom can worsen over time, patients were diagnosed kind of later in their life. We're unclear whether that's later in the disease progression versus a quicker onset. We're very unclear about that. But it has been misunderstood to be a older women's disease. And so when patients presented with these other symptoms, I being one of them, I had my first symptoms at age 8 and was diagnosed at age 40, with many years of different symptoms popping up and causing problems, but with no diagnosis, just being kind of told I have random symptoms in my life. What we're learning now is that Sjogren's can impact anyone at any age. And it's exciting that that message is getting out, because right now, the patients that we see coming to the foundation, we are seeing more and more women and men. That's really important because men can often present with more complicated cases and a greater impact to their life. Not to say that women are not greatly impacted, but it's so important that doctors understand that anyone can get this disease. And if you are seeing certain symptoms, take a look and add Sjogren's to your differential. Oftentimes, dryness is not the first presentation of Sjogren's. It can be major fatigue. It can be a neurological symptom. So for me, because some of my symptoms weren't diagnosed younger, a lot of parotid swelling and some fatigue, I was finally diagnosed when I had major fatigue, sleeping 15 to 17 hours a day, and aseptic meningitis. So I was hospitalized. At that point in time, I didn't even recognize dry eye at all. And I was living in the Palm Springs area and thought my extra dryness, oral dryness, was I'm living in the desert. I need to drink a little bit more water. But it still wasn't a dryness that was super cumbersome. It was a kind of a dryness that if I was going to take a long road trip, I put a case of water in the trunk to be ready. But again, that was not my major presentation. Now, over the past 20 years, it has become a major presentation of mine, dryness, as well as other symptoms. And the dryness really does greatly impact my life, both ocular and oral dryness. That's not my experience is not a super uncommon experience, especially those presenting with a heavy neurological symptom burden.
I think we don't often think about the neurological impacts, or that a neurological symptom might be Sjogren's. So are there new warning signs that patients should be, or potential patients should be looking for to ask their doctors about to see if they have Sjogren's?
Well, certainly dryness still tops the list. We conduct here at the foundation a patient study. We call it the Living with Sjogren's patient study. And the last time we conducted that was November 2021, and we compiled the data in early 2022. I encourage everyone to go to our website, sjogrens.org, and download the Living with Sjogren's patient survey data summary. You will really learn a lot about the patients from that. Now, back to other symptoms that patients might want to ask their doctor about Sjogren's. Dryness is still top. Dry eyes, about 95% of patients experience this. This is from this Living with Sjogren's study. We had over 3,600 diagnosed patients take this study. So it's a great sample. So dry eyes top, quickly followed by dry mouth. But then fatigue and joint pain and dry, itchy skin and brain fog, eye discomfort. Trouble sleeping is a significant problem, and peripheral neuropathies and other GI issues are super common. You kind of wonder all the exocrine glands in our system that help us live and process life, process food. There's a lot going on that could use some studying. Certainly, the majority of research in the field is about dry eye and dry mouth. And all of the exocrine glands should be studied, as well as the nervous system and symptoms such as interstitial lung disease. We have a higher propensity for ILD and, as I said earlier, lymphomas. So it's a complicated disease, but if you have major fatigue and some dryness, you definitely want to talk to your doctor. If you're having orthostatic intolerance is super common. Orthostatic intolerance and tingling and great fatigue and some brain fog. It's worth asking your doctor about, and then they can take a look at the diagnostic tools that we do have to see if they can diagnose you. The interesting thing about dryness that I always think is fascinating and adds to the difficulty in diagnosis is until a person's salivary function reduces to 50%, a patient can't necessarily tell that their mouth is dry. So you have to have a lot of damage and dysfunction before a patient goes, wow, my mouth is really dry. Something more abnormal than them just needing a little bit more water.
Yeah, that's a lot of symptoms and a lot for patients to tolerate. I think I've heard there's an emotional toll that patients with Sjogren's have to face as well. If you could speak a little bit to that.
It is really hard to understand if you do not have a chronic illness, the burden of a chronic illness. Sjogren's specifically can be heavily burdensome, even if your symptoms are predominantly the dry eye, dry mouth, if you aren't exhibiting other things. I think people that don't have dry eye and dry mouth assume that it's not as big of a problem as it actually is. And it is actually quite painful. It can, from dry eyes, it is painful. It can start eroding your cornea if you're not taking good care of it. Being able to do things outside if there's a wind is a problem. Sun exposure is a big problem for eyesight. It is very difficult to see with dry eye. And with the glare of the sun, the brightness is extreme. It's also difficult to see because you need tears to actually have good eye function, whether it's the eye itself or vision. So it is really quite a problem. I know the first time I started having a real challenge was with the emotional burden of things was when I was going out to dinner with a group of friends. I was already thinking, okay, I hope they have some soups. I hope they have some things I can eat. But we walked into the restaurant, and the restaurant was heavy with overhead fans. And my first reaction was extreme anxiety that I was going to disrupt my dinner party and my friends and be that person who said, we can't sit here. I'm not able to sit in this restaurant under these fans. And in that case, luckily, the restaurant could turn off one fan at a time, and we were able to sit in an area. But it is an odd thing to have extreme anxiety about a fan and extreme anxiety that you are going to be disruptive to your social group. That social disruption really plays out in a lot of ways. You may have a flare up or just symptom exacerbation when you had plans with friends and you need to cancel. You're really not able to do it. And over time, you learn that if you try to push through flares, they just get worse. So it's a matter of stopping and staying in bed that night and hopefully functioning as well as normal the next couple of days, or pushing through and staying in bed for a week or two. So it's a fine balance of how to manage life. You can tend to lose friends that don't understand why you might not be able to push through. Friendships certainly can alter. There is an emotional burden that both anxiety and depression add to the emotional burden. Some of those it's unclear how much could be inflammatory and disease associated, symptom associated versus the emotional weight of carrying a chronic disease. It's might be twofold with certain people. So I know it's a little long-winded, but the experience is really troublesome. The other depth of the experience that patients have is this is one disease that takes every kind of specialist. So we have to see so many doctors. It's a full-time job to take care of yourself. It's an emotional burden to have to train your doctors because we don't have enough knowledgeable experts out there about Sjogren's and how to treat patients. And it's a huge financial burden because you're not only seeing those doctors to stay on top of everything, taking your prescription medications. We have a disease that requires a lot of OTC products, and that can be really expensive. And these days, those prices are going way up. So there's a lot to contend with emotionally.
Yeah, that is a lot to for anyone to really bear. I wonder, since you mentioned the expense, if you could tell us a bit about our insurance companies willing to cover the expenses that Sjogren's patients need covered to lead
Yeah,
the best lives they can.
insurance is tricky. It is very tricky because we certainly need a lot of oral care. Given, I know I've talked about the disease as a whole, but the purpose of our podcast is to talk a lot about salivary dysfunction. And of course, with that comes a lot of caries, a lot of gum disease, expedited crowns, and restoration projects. it can really add up and get very expensive. And of course, dental insurance doesn't cover the majority of that. So, we as a foundation really stress prevention and really jumping on fluoride early instead of patients waiting until the first cascade of cavities that they get in front of it and just be diligent. But from an insurance perspective, that's not helpful. Now, unfortunately, there's better insurance support in the private insurance sector than CMS and what our older patients might be able to afford and do. And we fight that from an advocacy perspective, but it's a long journey, and CMS requires for payment and inclusion to tie a systemic health problem to oral care. Now, all of us in the field know that good oral health is good systemic health, but still the research to tie those two together is needed in order to get CMS coverage. One thing that we do have in late 2021, we being the foundation, worked hard and we were able to get new ICD-10 codes on the medical insurance side. And one of those codes includes Sjogren's with oral impact. If you're having a lot of oral issues, and this is something really good for clinicians to know, work with that patient's rheumatologist or primary care provider and ensure they have the ICD-10 code on their medical side. And then that patient, especially if the doctor writes a letter of support that, yes, this patient should be receiving medical insurance for this level of oral care because it is due to Sjogren's. So when you can get your dentist or oral med provider and your rheumatologist or whoever is caring for you, if it's a primary care provider, to work together, you can submit to your insurance, your medical insurance, and attempt to get some coverage. And this is private insurance. It might take a few submissions, but patients shouldn't give up. Just the first denial, keep on going. And there has been success with patients getting reimbursed, but it's a great deal of work.
That's encouraging, but it sounds like the role of the doctor is really important here. And I'm wondering if patients have trouble convincing their doctors. It sounds like you had a long journey to diagnosis. Like how seriously do doctors take these reports of fatigue and dry eye and dry mouth? And is it difficult to find the right doctor?
Right. It's a challenge because I have to tell you, I've talked to doctors that have never heard the word Sjogren's. It's not taught. It has not been taught. Now, with the increase of autoimmune diseases it's rising, and there's even some research associating global warming with that rise. But of course, we don't know why people get Sjogren's, but we have seen viral triggers as a possibility, and we have had an increase of patients after COVID. And then there's the patients who have this long arc of a journey, like me. So a very long arc. And it took me years to get diagnosed. I'd say before I got aseptic meningitis, I was trying to get diagnosed for the other things. And I'd been on that journey for about 5 years. The foundation has done some education with providers, but again, we have to educate every single doctor. It's a huge task. So we do the best we can, marching forward, doing CME programs with people, and having our experts teach the CME programs, whether it's a partner CME or one of our own CME programs attached to our State of Sjogren's, which by the way is January 31st, if you'd like to attend. We're focusing on the neurological impact of Sjogren's, and there is a CME attached to it. doctors who have heard of it but still have the thought it's just a nuisance disease, a dry eye and dry mouth, aren't listening to their patients. Doctors who are intrigued with the increase in autoimmune disease and they know they need to learn about it, are learning more and listening to their patients, and they're being taught that anyone can get this disease, men, young women. It's especially important for doctors to recognize this disease and diagnose it in young women, especially if they're interested in family planning, because there can be a serious impact to the fetus with fetal heart block if someone is Rho positive. So it's really critical for young women to get a correct diagnosis. Things are changing and improving, but we got a long way to go for doctors to really embrace Sjogren's and recognize it as serious.
Yeah, it's great. Your foundation is helping to raise awareness, helping to get the right information out there. I know there's a lot of research going on in the field as well that, is exciting, that may bring new therapeutics to bear for patients in the future. Just wondered if you could talk a bit about, what are some of the exciting new developments in research that
Oh
are
my
going on
gosh,
in the field.
so much happening. Two of our larger research programs are partnering with the NIH and the foundation for the NIH. The foundation doing uh, uh, projects that bring public, private, and industry together, along with the patient advocacy group. So the FNIH AMP programs, and we're in something called AMP AIM, the autoimmune immune mediated program, where in the AMP AIM there is lupus, RA, psoriatic arthritis, Sjogren's, and I hope they'll be adding scleroderma. That there's a team for each disease going deeper into the basic science of the disease, collecting data. And then at the end of the project, we're going to take a look at the data across all autoimmune diseases and try to look at commonalities, differences, and learn, hopefully something new and clear for both disease understanding as well as biomarker similarity for treatment and for Sjogren's, especially new diagnostic tools. There are other AMP programs going on. They have a HFpEF program, a heart HFpEF program. There's metabolic AMP. There's neurological, Alzheimer's, Parkinson's AMP. And what's interesting about those, they're doing the same thing in their segment, disease area, but they also are collecting that data. And we are going to be able to look across all diseases, all of the AMPs, and take a look at commonalities and, use AI to be able to crunch that data and find something. So we're incredibly excited about that. We just kicked off with FNIH, a biomarkers consortium program, and the intent there is really finding new biomarkers for new therapies, but also Biomarkers Consortium is all about precision medicine and being able to look at what biomarkers are on what an individual might need. Sjogren's is an incredibly heterogeneous disease, and precision medicine makes a lot of sense in our future for patients to really get the best care that individual is going to need. Then we do have other research programs. We have our own research grants, which we are very excited about. The past few years, we've invested over $1.8 million in research. It includes those two FNIH programs, but it also includes our grants. And we are on Proposal Central for any researchers out there. Please put in a grant or a proposal to be considered for our grants. March 1st is our deadline. And we are really looking for new and exciting ideas and hopefully to be able to advance what we know about the disease. And I consider clinical trials in the category of research somewhat, but in future therapy too. It is incredibly active. And if anybody's interested in becoming a Sjogren's clinical trial site, please call me. We need trial sites. Sjogren's has become incredibly popular right now. And we have, I'm either completing a trial, just recently completing a trial, in a trial, or coming into a trial, 10 different systemic therapies. It's nuts. Now, the challenge is all of those companies and the protocols are seeking the most ill patients. So when you combine the fact that we have a smaller set of the most ill patients, and we have a handful of trained Sjogren's trial sites, we can't get enough patients into those trials. So we are expanding our trial locations so that we can reach patients in other parts of the country. We are encouraging patients to enroll as much as we can. If you have Sjogren's patients, please have them call and discuss any of the clinical trials that are going on. We only have one clinical trial that is also running an arm for the less severe, so the moderate patient. So we can take a look at the therapy on two different populations, and we're excited about that. That trial can get more patients in. Hopefully a new therapy in 2 to 3 years.
Yeah, that would be great. That's really exciting. I've been really happy to see just a vast number of clinical trials and different approaches that are being tried for Sjogren's right now. I just wondered if you could just give us an overview of like the different approaches that are actually being tested in some of these clinical trials.
Well, what's is super exciting now, I'm not in a position to really talk about the mechanisms of action and tell you what's really happening, but we are really excited that there are different mechanisms of action in all of these trials, you know, from B cell depleters to CD40 ligands, and really, I think we have about 5 different mechanisms of action, and those companies that are doing the same, you know, a little bit different take on that particular therapy that they're presenting. So it is incredibly exciting because the patient is so unique. The disease exhibits so uniquely in all of us. I'm super heartened that we might have multiple drugs. And if one doesn't work for one patient, perhaps that CD40 ligand will. We just have an opportunity to care for more patients. And again, just have to get more patients enrolled and more trial sites, because it would be an incredible shame to have a strong therapy that would work not finish a trial because there aren't enough, the enrollment isn't high enough. We do not want that to happen. So all of us need to work hard to make sure that doesn't happen.
Yeah, so I think researchers can play a big role even beyond just doing the research in their labs. You'd mentioned that there are lots of opportunities for grants focusing on Sjogren's that researchers can apply for, even from the Sjogren's Foundation. And I believe there are also grants for students and trainees. Is that correct, that you offer?
Not currently with the foundation,
Okay.
unless they partner with more experienced, a student can partner with an experienced researcher. So we love seeing that. And we actually look at that. We have 4 different types of grants. We have a pilot grant for early ideas, early investigators, and we are super excited when we see a name that we have not seen before. We need to get more people into the field. And we love it when more experienced researchers are bringing in their students to join the Sjogren's research team. We have what we call a high impact grant, and those are our larger grants, $100,000 to continue an early idea or make a major impact in a new idea. We have partner grants. We have joined other organizations to look at something together. And we have what we call a dynamic grant. And this grant might not fit the timing of our normal foundation grants. It might be urgent. It might be something that's very unique. An example is the OMRF S-Gene project. It has been in existence, it's been going, but a couple years ago, year before last, we really needed to amp up the data set. Sjogren's is way behind on our data sets, and we are trying to get to 10,000. And so we supported that research project through a dynamic grant. So it wasn't a new idea. It was kind of this unique thing that a dynamic grant was really useful for that project. And it's been successful. Just a new report from that research team was a great thing to read.
That's exciting to find out about all the opportunities so that researchers can find a way to participate in the research in Sjogren's. How else can researchers participate in raising awareness, help promoting the work of the Sjogren's Foundation?
Well, there's several ways. I mean, as professionals, get involved with us as a professional. Our mission is, yes, we support and educate patients, but we also educate and provide resources for professionals. And we fund research. We've talked about the research grants. But for professionals, we have a complimentary newsletter called Sjogren's Quarterly. You can just go online and sign up for it. Keep informed. We talk a lot about the research projects in Sjogren's Quarterly. I mentioned State of Sjogren's. It's the last Friday every January, and January 31st is the 2025 program. You can contact us and sign up for that. It's a professionals only program. We are attending different conferences. So we might be at a conference that you're going to. We had a very large presence at ACR, American College of Rheumatology, Converge, and had a great program there. And we are one of the few patient organizations that create our own clinical practice guidelines. And that is because, unfortunately, Sjogren's has been placed in a, not worthy to spend time on category for decades. So we took it upon ourselves to write CPGs. We have a systemic CPG and a carry CPG and an ocular. Those are older. We're looking forward to updating them with so much new information. We have a fairly new pulmonary CPG that is really important. Chess published it. Pulmonologists love it. And we are working on our peripheral nervous system CPG. It's actually embargoed right now, and we found some really interesting things about that. So we have ways for you to attach to us to learn, because the biggest thing you can do that researchers and clinicians can do is to learn accurate information, be looking at their patients clearly, and if diagnosed with Sjogren's, treat them as serious patients. We want to prevent the trajectory of the disease worsening and causing more damage. We want to prevent fibrosing of salivary glands so that when we get a therapy, it might work. We have better functionality. And talk to one another about doing research. Something you can do, perhaps there, some lupus researchers that haven't looked at Sjogren's yet. We're so close, our diseases are so close. Something you've run in lupus could be very interesting to run in Sjogren's. We'd love to talk to you about that and get that research done, perhaps through one of our grants. So talking about it, talking about the new name, Sjogren's disease, not using the term secondary. We are not a secondary disease. We have the disease. We might have other diseases, 30% overlap with other rheumatic diseases, and just staying informed.
Yeah, I think people could also think about getting involved in fundraisers. I know my lab has done the Sjogren's Walk. It's held every year in October, and it's, I think, been virtual since the pandemic. So
Yes, since the
that's a great way to
pandemic.
involve students and other people you're working with in the Sjogren's field.
Thank you so much for bringing that up because, we do involve patients a lot in our donations, and we do involve uh, clinicians and researchers in our education programs, speaking to patients, writing for our publications. We have a patient newsletter as well called Conquering Sjogren's. But we can't grow and address this significant need without funds. And so getting your help on fundraising is really important. So it's something as simple as clicking the donate button on our website. Something as simple as we offer our CME programs at no cost. But we ask, could you donate? We're providing this, it's a cost to us. It's not a cost because it's so important to train professionals. So it's not a cost to you, but donating is important. Our spring walk series is kicking off just this Thursday on the 23rd. And we have walks in the spring and in the fall, and we have the majority in the spring. Some are virtual, and we have 2 that are live. Our Philadelphia and our Midwest and Madison, Wisconsin are live events. They are super fun and exciting, but our virtual events are really exciting too. Get a team together. Talk to your, if you're associated with a hospital, an educational hospital, get the ombuds team, an advocacy group together. They like to promote different causes. And contact your family and friends and help raise funds through those programs. You can find those on our website as well.
Thank you so much. I think we've learned a ton about the disease, about how we can get involved with research and advocacy. And I really thank you for this really engaging discussion. I've learned a lot, and I hope our listeners really have too.
Oh, I hope so too. Thank you so much, Dr. Larsen. It's been a pleasure.
Thank you so much. It was great speaking with you.
Okay, I would like to thank Janet and Mindy for taking the time out of their busy schedules to join us today. The conversation we had today has definitely provided some much needed insight into Sjogren's disease, and I'm sure many of us listening have learned something new today. We hope that the perspectives shared today guide future research and conversations regarding Sjogren's. And I'd also like to thank those listening. If you enjoyed today's episode, please leave a like and a comment. Thank you.